All right, well, first of all, thanks very much for the opportunity to make this presentation. I'd have to say that I think it's a very worthwhile initiative on your part to assess the evidence and make a decision on where you're going to go from there. I'm hoping that you received the documents that are the basis for this presentation. If not, I think that you would have access to them. They're all published documents. There's one exception, and I'll explain that exception as we go along. Just a note, too, on vocabulary. I'm going to be referring to domestic violence. Probably the better and more generic term is interpersonal, intimate partner violence. And in CSC, in our agency, the federal agency in Canada, we refer to it as family violence because we also address some parenting issues within the program as well. Okay, just wanted to say too that this presentation is not a long one. We only have about 15 slides, so I think that'll give us lots of opportunity to have a discussion and ask any kind of questions and have a bit of an exchange over these issues. Okay, so the outline of the presentation, I'm just going to start with a brief review of the outcome literature on the effectiveness of domestic violence programs in general. I'm not speaking at this point on the programs within Correctional Services Canada. Then I'm going to talk a bit about why these outcomes are generally not strong. And then I'm going to propose the application of the effective corrections model to domestic violence programs in general. And I'm going to present the results of a few studies that have used this approach. And finally, I'll just make some general recommendations based on the research that I know. First of all, before I start really into the program, can I ask, can you hear me well?
Yes.
Yep.
We have two tiny little holes in my computer. I can't believe that the microphone works so well. Okay, so I'm going to start now then with just a brief review, and this is probably not anything that is new to you. In fact, this is probably why you're here in the first place. The relative disappointing results on the effectiveness of domestic violence programs. I think that most people would agree that the better control studies find little or no treatment effects. We've had a number of meta-analyses over the last 10 years or so. They're not particularly encouraging. So I think that overall, the most optimistic conclusion that we can make about this area is that there may be a modest impact on reducing partner violence. Experts in the field have said it's really time for this area to grow. That's the terminology they use. Adopt a paradigm shift, shed the ideology that in many respects has kept the area from developing in the way that it should, and identify really what are the evidence-based methods that we can use to improve our results. And we all know, again, we're here for the same reason. We know that this is important because we know the damage that's done by domestic violence, family violence. We know that they represent a significant proportion of our correctional population. I was just looking at the Federal Bureau of Justice Statistics in the States, where they estimated that 4% of probationers have as their most serious crime domestic violence. And in the Correctional Services Canada, that's our federal system, we found that 40% of our population had an indication of a problem. When they were further assessed, we found that 20% were either moderate or high risk. Now, that doesn't sound very promising, but I'll just intervene here, or interject at least some good news, because the rates of intimate partner violence are going down. In the United States and Canada, I can say that this has been a trend for several years. It's going down in both directions, both male and female, male on female violence and female on male violence. These rates are going down, lethality is going down. So something is happening somewhere that's it's going in the right direction. Maybe this is the overall civilizing effect that Stephen Pinker talks about, or maybe the overall approach, the general approach, has had some impact. Okay, So why do we think there's just such discouraging results with respect to the studies on the outcomes of domestic violence programs? The literature suggests that possibly one of the reasons is that there are unaddressed mental health and substance abuse issues that might be affecting the outcomes. Others will say that our programs are not doing a good job of matching the needs of the offenders to the program content. Certainly, there is very, very high dropout rates. That makes it also very hard to assess the outcomes of these studies. But principally, my review of the literature would suggest that the principal reason the results are poor is that the programs are poor. Programs in generally are not well designed, they're not well implemented, and even the fundamentals of what we know by effective corrections are pretty rarely incorporated. And I also find that the treatment approach, and maybe this is changing over time, but certainly during the time where we would be assessing these programs, where we would be, where the results of the published articles would have been assessing programs, the treatment approach was very often adversarial and anti-therapeutic. The way the programs were implemented was often not carefully. There was not very good attention to the training and monitoring of the program delivery staff. And as I had mentioned before, the integrity of the materials was not what it could be. It's not what we know we should be doing for an effective corrections approach. Before I go further, can I ask if people know what I mean by the effective corrections approach?
Why don't you explain it, please?
Okay, I'm going to go into some detail now, but basically it's an approach that's based on a very high volume of empirical literature on what works for offenders to reduce recidivism. And based on this volume of research, Andrews and Bonta have identified 3 or 4 principles that are typical of programs that generate the best treatment effects or the best outcomes. And these are programs that adhere to the risk, need, responsivity principles. And the 4th principle, which I will talk about in a little bit more detail, is that of program integrity. So I'll go into more detail on that now, but when I refer to effective corrections, that's what I mean. These are programs that adhere to those principles. Okay, so what does this mean in the real world? What does adhering to the risk, need, responsivity principles really mean? Well, first of all, as far as risk principle is concerned, it means focusing on higher risk offenders and really applying almost no intervention or very little intervention for low risk offenders. You're going to get your best results from those offenders who are most likely to reoffend. The highest treatment effects, the best treatment effects. Secondly, as far as the need principle is concerned, and this is intuitive, but it's just not done very often, you address the factors that you know are related to domestic violence offending. In particular, you address the factors that are dynamic. That is, they're going to change, and that with intervention they will change and be reduced, and that reduction is likely to reduce risk. So changeable factors that are related to domestic violence. And I'll go over this in a little bit more detail shortly. And finally, the responsivity principle is the principle, it used to be known as simply use cognitive and behavioral and skill building approaches. It's gotten to be a much broader term now, and it means use approaches in general that engage the offender, that help him understand the material, that are sensitive to cultural changes or cultural circumstances, and are collaborative. So most of all, they're respectful and collaborative. Now these do not seem outlandish as approaches. You would think that these would be incorporated into most treatment programs without the benefit of perhaps a broad reading of the literature. But I can tell you that I work I work in the Correctional Service of Canada, the federal system, but I also do some consultation outside of this agency, and I can speak to what happens, for instance, in the province of Ontario, where they only treat low-risk offenders. Why? Because they're going back to their families, and the judges want to make sure they're treated before they go back. There is nothing for high-risk offenders. And I can also speak to a treatment facility, a prison that is a treatment facility for the province. And then, again, they will only treat the low-risk offenders. Why? Because they're more amenable. They're easier to have in group. They have a short time with the offenders. They don't want to work with the troublesome offenders. So although it's intuitive that we should be focusing service and attention on higher risk offenders, it often doesn't happen. And we really can't do better than what low-risk offenders are going to do without treatment. Very few low-risk offenders are going to reoffend. So intervening, although it may provide them with some insight, some skills, it's unlikely to reduce the recidivism, which is already going to be extremely low. And on the needs principle, I will go over what the evidence suggests are the needs, the dynamic factors that should be targeted. But too many of the programs that I've reviewed target factors that are not related empirically to domestic violence reoffending. For instance, sex role stereotyping, roles of women, there is not a strong evidence base for that. And many programs focus almost uniquely on that. Using respectful approaches, I can tell you that I was in Florida, again on a consultation, and the facilitators there were telling me that they would not be certified if they showed any kind of kindness towards the offenders they were treating. One person lost her accreditation because she shook hands with the offenders. So although it may seem very, very obvious that you must use therapeutic techniques if you expect people to respond to what you have to say, it's just not done, or it has not been done. And that, again, may be part of the reason why our outcomes have not been what we would like to have seen. So when you do use these principles, when you use the risk, need, responsivity principles, when you pay attention to issues of program integrity, what kind of outcomes can you expect? So right now, what I'm going to do is talk about two research studies that we've done within the Correctional Service of Canada and what those outcomes are. And again, you have documents, or you have access to these documents. They were sent out to Alicia. And the other research project, the outcome is based on our programs, but it's been in the UK for about 8 or 9 years. So they've been able to finally evaluate that program. But it's based on all the same principles, and they're very, very careful about the way they implement their programs in England as well. So let me just talk about what this means. Within CSC, all of the offenders who come in are assessed on initial screening, whether they may have a domestic violence past. If they hit any of the screening criteria at all, any of the items, then they're referred to more in-depth assessment. And that is with a specific domestic violence tool. We use the Spousal Assault Risk Assessment Guide, which is the SARA. And based on the results of that, only offenders who are deemed moderate or high risk are referred to a program. The moderate risk offenders go to a moderate program, the high risk offenders to a high. The needs that are tackled in the program are those that are directly related to domestic violence. I'll review those in a few minutes. And our facilitators are very well trained. They use skill building methods. They have their sessions reviewed by supervisors, and they spend quite a lot of time in their training on how to develop collaborative techniques. In addition to this, I should add, there are also community booster sessions. So these programs are offered in the institutions, but there are booster sessions or maintenance sessions that are offered to the offender once they're released and still under community supervision. This is the result. I'm showing you this is the result of the initial outcome study of our high intensity and moderate intensity programs. I'm going to focus a little bit on this because it's one of there aren't that many studies that provide outcomes on spousal violence. And that's because, at least in Canada, we don't have a specific charge for spousal violence. So you have to do a file review to determine if the assault was an assault against an intimate partner. So this is laborious, it's time consuming, it's expensive. So I'll spend a little bit of time on this study. The other two studies that I will talk about just look at the impact on general recidivism. So this study is showing that the numbers are relatively small. So for those of you who have any background in research, you know that it's more difficult to generate a power to detect difference. You do see a difference between the rates of spousal violence between the treated and untreated group for the moderate intensity. You see a significant one for the high intensity where you have a little bit more power because, again, the reoffending rates are higher for the high intensity. But when the two groups are combined, you see that there's a significant difference. The star indicates a significant difference between the treated and the untreated group with respect to spousal reoffending and any violence reoffending. We are not seeing, there is a difference, but not a significant difference on any infraction. And by that, it can mean an offense, but it can also mean a violation of a condition, a return to custody for technical reasons. We don't see an impact of the program on that. There's another way to present this data, and I'll just show you using odds ratios. And I think probably the best thing to do is to take a look across the first bar there at the combined groups. The odds ratio is 3.76%. So that means that they're between 3 and 4%, 4 times more likely to have a spousal violence if they are not treated. And that's a significant effect, a highly significant effect. For any violence at all, we see that they're twice as likely to have any violence. That level, that significance level is generally a little bit less than what you would like to see. You'd like to see 0.05, but it's trending in that direction. So I would say that with a larger sample, we would expect to get a significant effect there. Again, we do not really see a significant effect for any infractions. There has been also, I think I sent you, one of the documents I sent you is a very large document on the correctional program evaluation. Every 5 years within the Correctional Service of Canada, all of our correctional programs are supposed to be evaluated. So that document has all our programs, but embedded in it, there's also the outcomes of the family violence programs. And this found that there was, in fact, a significant treatment effect for a reduction in recidivism with the CSC's Moderate Intensity Family Violence Program. The Conference Board of Canada, these are economists who look at cost-benefit analysis of interventions. They, based on some of the research that's been done within CSC, they calculated the net cost benefit of CSC's family violence programs. And they concluded that the federal government, this did not include any expenses or any savings that might have been realized at the provincial level, that the federal government saved $6,449 per participant through reductions in recidivism relative to the cost of delivering the program. The document that I don't have for you, because although it's been peer-reviewed, it hasn't yet been published, is the study in the UK, where again, as I've mentioned, they used our program, they adapted it somewhat, but they definitely used this approach and had very, very careful implementation strategies. They also found a significant effect. Again, it's for recidivism. They didn't do spousal violence. I regret that they didn't, but you can understand why. It's very expensive, labor-intensive to do that. So then this comes to how do you apply the effective corrections, the risk needs responsivity to programs? Really, what does this mean? How do you do it? So first, starting with the risk principle. Risk has to be assessed, and I would say that risk needs to be assessed for more general recidivism and specifically domestic violence recidivism. And over the years, they've been quite well develop tools. And there are specific tools for those constituencies who are really concerned with lethality. Very good tools for that too. So you have a choice of very good tools that will assess the relative risk for domestic violence. And then you proceed from there by only treating those who have a significant risk. I don't mean that they have to be the highest risk, but they have to have a risk. And I would not encourage treatment of low-risk offenders unless it's possibly couples counseling or something along the line. I think I mentioned that one of the observations is that this area needs to shed ideology. And there are phrases that we've repeated over the years, over the last 15, 20 years, that are just not empirically supported. One hit leads to another. I'm just going to quote from Statistics Canada. That is not an accurate assessment. Statistics, our national survey of violence against women found that people whose partners, I'll just start here. That it's very rare, in fact, that offenders will only 1% of the offenders who were noted in Statistics Canada's survey were so-called chronic offenders. Those offenders seem to be quite impervious to treatment, but they represented only a very small proportion of the population. There are okay, so let's go on to the need principle, and I think that there are ideological issues related to what should be the appropriate targets for treatment as well. And this is based on my review of the literature. You have the journal article that this is based on, the principles of effective corrections applied to domestic violence. The strongest evidence is for substance abuse. And I know that also part of the ideology was that drinking doesn't cause substance abuse. It doesn't cause it necessarily, but it's certainly strongly related to it. Again, we're looking at Statistics Canada survey showing that people whose partners were heavy drinkers, 5 or more drinks a day, were 6 times more likely to experience spousal violence than those who had never had any heavy drinking. Another study found that men entering a domestic violence treatment program or an alcoholism treatment program were 8 to 19 times more likely to have perpetrated violence on the day that they were drinking than on a non-drinking day. It's clear. It's clear that substance abuse is an appropriate target for domestic violence, to reduce domestic violence. And I think in the States, it's linked as well to the use of drugs. In Canada, it's more clearly related to alcohol. Another one of the phrases that we've been kind of weaned on was that anger management is not an appropriate intervention for men who abuse women. In fact, I think there may even be some states that don't allow anger management programs. Well, in fact, there's very good evidence that emotion management should be a key target for these effective programs, in particular the targets that help the men address anger and jealousy. I can just give you some idea of what the research is saying about jealousy, for instance. Myrna Dawson did a review of over 700 intimate partner homicides, and she found jealousy to be a factor in 45% of these cases. Violent husbands, another study, violent husbands were more likely than non-violent husbands to report anger in response to their wives' behaviors. And severely violent men reported the highest level of anger relative to non-violent men. I think it's definitive. Emotion management is an important target for these programs. The other areas where there's good evidence is on cognitions, that is the beliefs, but not beliefs related to sex role stereotyping, not beliefs related to traditional sex roles, not beliefs related to patriarchy. In more egalitarian societies like Canada and the United States, the cognition that needs to be the focus is the belief that it's okay to hit. It's okay to hit women. It's okay to be violent. they can justify that. These are the cognitions that need to be tackled. The evidence for the value of tackling patriarchy is very weak. I think meta-analysis only found a couple of studies that indicated that there was an effect size. Problems in self-regulation, good evidence there. These men tend to be impulsive, and part of their impulse control and problems with self-regulation is also emotion management. What's important to target in these cases is to refrain from acting on violent impulses. People, men and women, have violent impulses, but people who are nonviolent learn to control those impulses. And in terms of program design, what we focus on in those cases is the role of relapse prevention, helping the offenders to understand what's likely to be provocative for them and what techniques they can use to manage the anger and the jealousy that they feel in the face of those situations. Another area that has very strong research support is deficits in social skills. And now these have research support in particular for healthy relationships. So it's not as clear that they reduce reoffending, but they're foundational for forming healthy relationships. These are communication skills, negotiation skills, and really the basis of everything, problem-solving skills. There are other factors that I found were related to domestic violence, but it's less clear how addressing them, what kind of an impact they have on reducing domestic violence. There's certainly good evidence that men who have had personal histories of being a victim as a child or witnessing domestic violence as a child, they have higher rates of domestic violence. And obviously that's an historical factor. You can't do anything about that, but you can do something about his response to that and how he feels about that and how he can make changes not to visit the next generation with these terrible pasts, these terrible histories. Another factor within CSU, we've seen that this has been important, association with peers that demean women or support violence towards women. And that can even mean spending all your leisure time with men. We found in one study, I shouldn't say we, but one of my colleagues found in his study that men who had killed their partners were more likely than general offenders to be parts of participating in all male sports teams. Okay, so those are the needs. Those are the needs that have an empirical support for addressing, that should be addressed in the programs. Let's look at responsivity. What we're looking for in responsivity is techniques and curriculum design and program delivery methods that promote understanding so that the participants see the relevancy of what they're doing and they understand it. I know one of the problems that we've had even within our agency is making it simple enough so that they understand it. Sometimes our skills get perhaps more complicated than they should be. Keep it simple, keep it clear, keep it relevant. You match the treatment strategy to learning style, so that may mean using more than one type of learning approach. You might want to use videos. You certainly use a lot of role plays. Role plays are foundational. You address motivation problems, and you acknowledge, you don't have to be of the same cultural background, but you acknowledge the role that culture plays in people's attitudes towards women and towards violence and violence towards women. And where possible, you incorporate strength-based strategies. And by that I mean we don't always point the offenders to what is wrong with them and what needs to change. We also say, what do you have on your side that's going to help you to stay free of violence and abuse? And that involves some assessments, some interviewing, and some understanding of the offender, what he brings to the table. It's going to be helpful for him. This final bullet is an approach that I find I like. Again, we haven't yet seen the empirical support for it, but I don't know if any of you know the work that Shad Maruna has done on making good, that is the change in personal identity that happens with offenders who tend to desist from crime. So I believe that it's a worthwhile pursuit. We do it within CSC, Correctional Service Canada, to encourage offenders to develop a pro-social identity. Who are you? Who do you want to be? What kind of a father? What kind of a partner? And how can you get there? Perhaps above all, responsivity requires relationship skill building. We need to hire facilitators who know how to do this, to develop rapport, to reinforce strengths, who provide pro-social modeling themselves, who show an interest in the offenders and an understanding for their situations, and use mutually collaborative approaches to set goals. Not all the targets of the program are going to be as relevant for every offender, so you work with the offender to determine which of these goals in particular, which targets in particular, are the ones that he wants to work on. This is not part of the RNR, not part of the three major principles, but it's certainly part of the effective corrections approach. This is program integrity. And this means that the program is run according to a set of approved standards that treatment providers and managers understand, and that the compliance with these standards are assessed. Detailed and scripted manuals are used. That doesn't mean you have to be rigid. That doesn't mean you have to say exactly what's in the manual. You're afforded a flexibility within the script to address the needs of the group. But we know that the approach is standardized and that the content of the manual is respected. Adherence to the manual is important. As I mentioned, the goals of the sessions have to be met, and the facilitators need monitoring, either through live observation or through videotape review of key sessions. And it would certainly be helpful in contribution to the literature if evaluations, outcome studies were conducted periodically. I know that many agencies are small. They're probably not all that well resourced. The number of offenders maybe who pass through their systems are not that great, but an effort should be made to plan evaluations periodically. This is another factor, and I think maybe a factor that may have helped to reduce the general rates of domestic violence. It's not within the effective corrections framework, and it's not necessarily something that all agencies can be involved in, but in general, community response is important, and that means a coordinated community response. Agencies work together to protect the victims. They know what the victim services are. Courts and policing provide effective arrest policies. Within Canada, we have, in some units, high-risk units for women who have very, very dangerous ex-partners. Minimally, though, if you're providing a program, a domestic violence, family violence program to offenders, the current partner should be contacted. Information on the program should be provided, and she should be aware that the program is not her safety plan. She should not assume that because he attends a program, he's going to be better. And she should also be provided with any kind of safety planning or community resources contact if she needs it or if she wants it. Okay, so my conclusion, I do believe that domestic violence programs can work. I believe, unfortunately, that the whole area has not moved forward in the way that I would like to have seen. It didn't move forward like, for instance, more general correctional programs have. It didn't move forward like sex offender programs have. And I think that we can do much better. I think that if the domestic violence programs are going to work, they have more likelihood of working if they adhere to these principles: risk, needs, responsivity. And finally, I wouldn't be a researcher if I didn't think that more research is required. So that's my presentation. These are my 16 slides. And I'm happy to take any kind of questions or even hear any kind of discussion that people would be interested in.
You're on, Kate.
How many people were included in this study?
Could you hear that?
Sorry, which study?
How many people were included in the study?
If you look back on the slides here, you see the ends? Those are the people who were included in the initial study.
So 246 people were in the study?
There were 160 treated, and the others were 100. That's right, 160 treated, and the others were the untreated. That's for the preliminary research. I'm sorry, I don't have direct access to the correctional evaluation study, but I think you have that document. The numbers were higher for that.
Dr. Stewart, one of the things that you said about the programs not related to patriarchy, when you also said, I'm just trying to follow up on that a little bit, because then you also said talking about jealousy has emotion management, and I was just thinking, well, isn't jealousy related to possession, which is part of ideas, patriarchal ideas? And the other thing you said that sort of surprised me is you identified the U.S. culture as an egalitarian culture, which we all laughed at. Which is just sort of like, what?
Okay, well, okay, I'm talking relative to, say, some other cultures where women expressly have a less egalitarian role to play. Okay, so you're saying that jealousy is an expression of patriarchy?
Well, possession, jealousy to me, and that's in part of this training, is jealousy. You're jealous when you think that you can possess the person, which is part of power and control. And so I was having a little bit trouble with the statement about the cognitions related to patriarchy, because I think unfortunately a lot of cognitions that are invisible to us are related to patriarchy. And to me, it was correlated when you identified the U.S. as an egalitarian. I don't know enough about Canada to honestly, Canadian culture, to say that it might be egalitarian, but I do not consider U.S. culture egalitarian at all. But
okay, well, probably relative to a lot of other cultures, it would be considered relatively egalitarian, at least in principle, on paper. And I would have to ask you, if you see jealousy as part of patriarchy, how do you account for female jealousy? Because certainly that's an issue as well.
It's related to possession. It's that whole concept. I mean, I liked what you said about healthy relationships, but I would say a healthy relationship is egalitarian. But I think it's very difficult to have a healthy relationship in a culture that is not egalitarian. So I just want to explore and unpack.
Okay, well, I can address that. I mean, it makes intuitive sense that in societies or in cultures, even in relationships where men believe that women have an inferior role, that they would be more prone to violence. But the key to it is not necessarily the role of the woman relative to the man. The key is she has a subservient role to me, and if she doesn't do what I want, I'm okay with hitting her. I feel justified in hitting her. And I am saying that the part of that phrase that's most important, more important, is it's okay to hit. Because you will find that there are a lot of traditional societies where women have very prescribed roles that we would see perhaps as not very egalitarian, where the rates of violence are not high, because there is no approbation for violence.
Okay.
So what I'm saying is, a lot of these men do not feel powerful. They don't feel powerful at all. And when you talk to them about power and control, they're completely baffled by that. But when you talk to them about, when I get angry, I feel justified to hit her, that resonates for them. And that's something you can tackle.
Well, I think maybe that's the.
I should also mention that. Yeah, go ahead.
Oh, I was just going to say maybe that's the disconnect, because maybe power and control the language, but in terms of their behaviors of manipulation and using power and control, they may not self-identify as powerful individuals, but they're using those techniques to control. And so maybe that's where I'm having the disconnect with violence. To me, hitting is just one tool.
You know, I think part of the issue with the emphasis on patriarchy has been the samples from which that original research were taken, and they were taken very often from research that was done with women who were in safe houses or shelters, and they had extremely violent experiences with the partners they had, who were in many ways, I guess you would call them patriarchal terrorists. What I'm saying is that this is not the general case. If you look across the board at the research, there's very little research that will support patriarchy as a major component of an effective treatment program. Very little. I'm just presenting the evidence base for this. I am not saying that it doesn't apply to some relationships and to some women who've had some horribly violent relationships, but I'm talking about in principle across large numbers. The research does not support this as a major part of the initiative. And I would say that as we become more truly egalitarian, the chances are that violence towards women will be reduced, because there will be one less reason or a whole series of fewer reasons why men feel justified to hit. But if you're going to tackle, if you have a short period of time to tackle factors, dynamic factors, risk factors that you know are related to violence, tackle their substance abuse, tackle their anger management and jealousy issues, tackle their cognitions of permitting them to hit women or to abuse women, tackle their very poor impulse control, and that's where you'll get your mileage.
I guess I'm having trouble with understanding what you mean by don't use patriarchy, because so many of the elements you're describing fit a patriarchal framework. So I think I'm just having a disconnect.
I think she's talking about using these as a Trojan horse. You know what I mean? Like
I don't know how this
as a most direct way to engage the offender, and that when you're engaging directly on issues of patriarchy, that you're disengaging the offender. So if you want to get the most effective work done, to focus on these is what she's saying that the research says is effective. So it's not that, I don't think there's disregarding of that patriarchy or a history of oppression is the sources of power and control in our societies, but if you want to directly engage offenders, and that these are path of least resistance, it's sounding like.
And I also wonder if part of that is related to looking at a high-risk client versus a lower-risk client. So for a higher-risk client, patriarchy and culture and gender identity may not be what's motivating them to be violent. That it's the emotion regulation, it's the, and emotion regulation is also, I feel powerless. So that's what I think that's kind of what I'm hearing too, is that it's versus high risk versus lower risk. So maybe with lower risk people, that
psychoeducational piece around
patriarchy, that gender roles, socialization, social justice piece, may be an easier way to get them to do that, right? So
I think it's also important. I mean, patriarchy is a condition of society. It's not the condition of a person. And so what is happening is we're kind of disconnecting between when we're treating these offenders, when we're making decisions about which offenders to treat, these are offenders who have committed acts of violence, which are crimes, and they need direct intervention for that issue. It may be that the perpetuating of violence in society is certainly due to patriarchy, but patriarchy is a condition of the society, and it's not something you can directly target. I think historically we've tried to educate offenders about patriarchy, and that's where the disconnect happens, because in their sense we're giving them a high order concept and saying this is why you're committing these acts of violence. And they're thinking to themselves, no, I got drunk and I was mad. And so we're missing
that I can tell you, it does not resonate for them.
Yeah,
it does not resonate for them. What we found is that the power and control wheel does, just insofar as it gives them a list of what the abusive behaviors are, because oftentimes they've used abusive behaviors and didn't count them as abusive. So the power and control wheel helps them understand what abuse is and how it's used. But when you talk about patriarchy, it does not resonate with them. And you can lose them right away if you start emphasizing that.
I have a question.
Thank you. Those clarifications were helpful.
So I think a lot of our programs are conceptualized as educational. And so I'm wondering if the way that you think about this programming is educational or therapeutic and more from like a clinical perspective?
I would say that educational is for the low-risk offenders,
Okay.
and that for anyone with any level of risk, you need to use skills-based programs.
And
It's
so are
definitive.
people, the facilitators then, do they tend to be people with master's degrees? And
No, they don't. They tend to have degrees, but they don't have master's degrees. They're just well trained on role plays, skill building, and how to overlearn these skills and these approaches with the offenders. And in England, I think they don't always have degrees. They come from I think in the States you might call them guards. They call them wardens there.
This is will seem like a non sequitur question, but I was asked to ask this question, and it is: how did you measure recidivism? Was it arrest or conviction, victim reports? How did you...
Okay, that's a good question, and I should have explained that to you. With the study that we used, and you'll see it in the if you have the article. Spousal violence, we had a very strict test. Any violation that was related to violence as spousal. So violation of a non-contact order, anything, even a phone call that was not appropriate. So we were very strict about what we counted as a spousal. Yeah.
Did you count that?
Did you count for any violence? It included sex offending, any violent spousal, and any general assaultiveness. But as I've mentioned, any infraction, that could have been drinking again, it could have been not showing up for an appointment, it could have been anything like that. And can I just add something that I didn't mention in my presentation, is that domestic violence programs, unless they're more generally based towards addressing antisocial behavior in general, and in fact these skills do address antisocial behavior in general, they can't be expected to reduce any infractions, right? Because we don't talk about it in the group. We don't encourage them not to do this. We don't encourage them to stop their drug dealing or to stop their break and enters. If you want to reduce general recidivism, if that's your target, then that has to be part of the consideration of the content of the program. And we have actually adapted our program so that we look much more broadly now at what we see as antisocial behavior. With the domestic violence offenders, obviously
Come back.
See, I've got an error message. Can you hear me still?
You just came back. Yep.
Repeat?
Could you repeat your last sentence?
Can you hear me?
Yes.
Yeah.
Okay, I don't know. I've been on a bit of a rant, so I don't know how much you missed.
I think just.
But I was just saying that if you're going to test the efficacy, you left again. Can you hear me now?
Yeah.
Hello.
We're here. We can hear you.
Can you hear me? Okay. If the test of whether your program's successful or not is general recidivism, then your program content has to include that as a target. We can't expect a program to reduce general recidivism if we never talk about it, if all we talk about is spousal violence or relationships.
I think this is the last question.
Can you just talk a little bit about how these programs are administered here? I don't know, it might be 50%. Some are housed within the victim service agency and others are community-based programs. So is the offender programming there as part of like the programming that you're talking about in this presentation? Is it housed in as victim services or is it something outside of that?
No. It's within the Correctional Service of Canada, and I should probably have introduced you a little bit to what the agency is. The agency only is responsible for men and women who are who have been sentenced to at least 2 years. They tend to be the more serious offenders. They also tend to be somewhat older, perhaps. The average age is about 33.
I'm sorry, so are they currently incarcerated, you're saying?
They're all of these programs are delivered by our own staff. So the ones that are delivered in the institutions are delivered by program facilitators in the institution, and those that are delivered in the community are also our correctional service staff. So none of this is through the portion of CSC that that administers is the Reintegration Programs Division,
So how,
not Victim Services.
okay, so, and, what,
Hello?
yeah, what is the collaboration then between the Victim Service Agency and this program? What's the mechanism for keeping them connected?
We have victim services, so victims who are registered victims are contacted, and as I mentioned, at a minimum, we're required to make contact with the current the current partner. But victim services is something that's done more or less on apart from CSC. There is a victim services division, but they're more focused on keeping the victims informed about parole hearings and the progress of the offender against his sentence milestones and so on. The victim services portion of services within Canada is in the community, and that would be a separate set of agencies.
It's interesting just to hear how differently we're structured.
Yes. It's very hard to compare the two. I guess if we were to compare this at all to your system, it might be a little bit like your federal system.
Right. I mean, it's definitely, there's a lot to learn from it, and it's inspiring on certain counts for when we're looking.
You know, a process that might be closer to yours is in England, where they incorporate everything together. They have only one level of incarceration, one level of sentencing, and the community component is done through, incorporates all of this, victim services and so on. So if you want to email me, my last slide, I hope you have a copy of it. It has my email address. I can put you in touch with people in England who perhaps are dealing with issues that are closer to what you deal with. See, our issue is that our offenders, when their sentence is over, we're not able to help them anymore. So their issues, their families' issues, their victims' issues are taken over by agencies in the community.
All right. Well, Lynn, thank you so much. Yay.